Menstrual cycle. Courtney Cox was the first person to call a period on national television. Year? 1985. Menstrual cycle is governed by our body's hormones. The physical experience of a period, the bleeding, cramps, emotional swings, tender breasts. It all comes down to the amount of hormones your body is releasing at any given time. And two hormones in particular dictate your cycle. Estrogen stimulates the growth of the uterine lining, while progesterone regulates that growth. When you're not ovulating, you don't have the regulatory control of the progesterone. So you can get these periods. They come, they don't come. Then there can be heavy, intermittent bleeding. Pain associated with menstruation is called dysmenorrhea. Dysmenorrhea is a Greek term for painful monthly bleeding. Dysmenorrhea causes severe and frequent cramps and pain during your period. More than half of women who menstruate have some pain for 1 to 2 days each month. Usually, the pain is mild. But for some women, the pain is so severe that it keeps them from doing their normal activities for several days a month. Dysmenorrhea is a common complaint among women during their reproductive age. Dysmenorrhea is associated with significant emotional, psychological, and functional health impacts. Menstrual cramps happen because of contractions in the uterus, or womb, which is a muscle. If it contracts too strongly during your menstrual cycle, it can press against nearby blood vessels. This briefly cuts off oxygen to the uterus. It's this lack of oxygen that causes your pain and cramping. Etiology. Many theories have explained the etiology of dysmenorrhea since the 1960s. This includes psychological, biochemical, and anatomical etiologies. The anatomical theory included abnormal uterine positions and abnormalities in shape or the length of the cervix. What are the symptoms of dysmenorrhea? Most women have some pain with their menstrual periods. For some women, severe pain comes with other symptoms, including diarrhea, nausea, vomiting, headache, and dizziness. Cramping in the lower abdomen, pain in the lower abdomen, low back pain. Pain radiating down the legs, fatigue, weakness, fainting. The symptoms of dysmenorrhea may look like other conditions or medical problems. Dysmenorrhea can be classified as primary and secondary dysmenorrhea. Primary dysmenorrhea is a lower abdominal pain happening during the menstrual cycle, which is not associated with other diseases or pathology. In contrast, secondary dysmenorrhea is usually associated with other pathology inside or outside the uterus. Primary dysmenorrhea is the cramping pain that comes before or during a period. This pain is caused by natural chemicals called prostaglandins that are made in the lining of the uterus. Prostaglandins cause the muscles and blood vessels of the uterus to contract. On the first day of a period, the level of prostaglandins is high. As bleeding continues and the lining of the uterus is shed, the level goes down. This is why pain tends to lessen after the first few days of a period. Primary dysmenorrhea begins soon after a girl starts having menstrual periods. In many women with primary dysmenorrhea, periods become less painful as they get older. This type of period pain also may improve after giving birth. The pathophysiology of primary dysmenorrhea is not well understood. Nevertheless, the identified cause is due to the hypersecretion of the prostaglandins from the uterine inner lining. Prostaglandins increase the uterine tone, and also cause high-amplitude contractions of the uterus. Also, vasopressin has been linked to primary dysmenorrhea. Vasopressin increases the uterine contractility and can cause ischemic pain due to its vasoconstriction effects. The uterine contractility is observed to be more prominent in the first 2 days of the menstrual period. Progesterone levels drop before menstruation, which leads to increased production of PGs triggering dysmenorrhea. Secondary dysmenorrhea. Secondary dysmenorrhea presentation is a clinical situation where menstrual pain can be due to an underlying disease, disorder, or structural abnormality either within or outside the uterus. Secondary dysmenorrhea is caused by a disorder in the reproductive organs. The pain tends to get worse over time and it often lasts longer than normal menstrual cramps. For example, the pain may begin a few days before a period starts. The pain may get worse as the period continues and may not go away after it ends. Some of the conditions that can cause secondary dysmenorrhea include the following. Endometriosis. Endometriosis happens when tissue similar to the lining of the uterus grows in other areas of the body. It grows on the ovaries and fallopian tubes, behind the uterus, and on the bladder. Like the lining of the uterus, this tissue breaks down and bleeds in response to changes in hormones. This bleeding can cause pain, especially around the time of a period. Scar tissue called adhesions may form inside the pelvis where the bleeding occurs. Adhesions can cause organs to stick together, also causing pain. Fibroids. Fibroids are growths that form on the outside, on the inside, or in the walls of the uterus. Fibroids located in the wall of the uterus can cause pain. Small fibroids usually do not cause pain. Adenomyosis. Adenomyosis develops when tissue that normally lines the uterus begins to grow in the muscle wall of the uterus. This condition is more common in older women who have had children. Problems with the uterus, fallopian tubes, and other reproductive organs. Certain defects that a woman is born with can result in pain during menstruation. Other conditions. Some medical conditions can flare up during a period and cause pain. These conditions include Crohn's disease and urinary disorders. Other causes of secondary dysmenorrhea include the following. Pelvic inflammatory disease, PID, abnormal pregnancy, miscarriage, ectopic, infection, tumors, or polyps in the pelvic cavity. What are the risk factors for dysmenorrhea? While any woman can develop dysmenorrhea, the following women may be at an increased risk for the condition. Women who smoke, women who drink alcohol during their period. Alcohol tends to prolong menstrual pain. Women who are overweight, women who started their periods before the age of 11, women who have never been pregnant. Risk factors. You might be at risk of menstrual cramps if you're younger than age 30. You started puberty early, at age 11 or younger. You bleed heavily during periods, menorrhagia. You have irregular menstrual bleeding, metrorrhagia. You have a family history of menstrual cramps, dysmenorrhea, or if you smoke. Complications. Menstrual cramps don't cause other medical complications, but they can interfere with school, work and social activities. Certain conditions associated with menstrual cramps can have complications, though. For example, endometriosis can cause fertility problems. Pelvic inflammatory disease can scar your fallopian tubes, increasing the risk of a fertilized egg implanting outside of your uterus. Ectopic pregnancy. How is dysmenorrhea diagnosed? To diagnose dysmenorrhea, your doctor will evaluate your medical history and do a complete physical and pelvic exam. Other tests may include ultrasound. This test uses high-frequency sound waves to create an image of the internal organs. Magnetic resonance imaging, MRI. This test uses large magnets, radio frequencies, and a computer to make detailed images of organs and structures within the body. Laparoscopy. This minor procedure uses a laparoscope. This is a thin tube with a lens and a light. It is inserted into an incision in the abdominal wall. Using the laparoscope to see into the pelvic and abdomen area, the doctor can often detect abnormal growths. Hysteroscopy. This is the visual exam of the canal of the cervix and the inside of the uterus. It uses a viewing instrument, hysteroscope, inserted through the vagina. How are painful periods treated? Medications are usually the first step when treating painful periods. Certain pain relievers target prostaglandins. These medications, called nonsteroidal anti-inflammatory drugs, NSAIDs, reduce the prostaglandins made by the body and lessen their effects. This in turn makes menstrual cramps less severe. Most NSAIDs, such as ibuprofen and naproxen, can be bought over the counter. How are NSAIDs used? NSAIDs work best if taken at the first sign of your period or pain. You usually take them for only 1 or 2 days. Women with bleeding disorders, asthma, aspirin allergy, liver damage, stomach disorders, or ulcers should not take NSAIDs. What other medical approaches can help with painful periods? Birth control methods that contain estrogen and progesterone, such as the pill, the patch, and the vaginal ring, can be used to treat painful periods. Birth control methods that contain progesterone only, such as the birth control implant and the injection, also may reduce period pain. Can the IUD be used for painful periods? Yes, the hormonal intrauterine device, IUD, also can be used to treat painful periods. For many women with an IUD, menstrual bleeding gets lighter the longer the IUD is in place. In some cases, bleeding stops for women with an IUD. If you are not trying to get pregnant, you and your OB/GYN may talk about hormonal birth control methods as a form of treatment. What alternative treatments can be used to ease period pain? Acupuncture, acupressure, and nerve stimulation therapies may be useful for treating painful periods. Physical therapy that eases trigger points also may help with pain. Are there other physical therapies that can help with period pain? Some types of physical therapy teach mental techniques for coping with pain. These types include relaxation exercises and biofeedback. Can vitamins help with painful periods? Vitamin B1 or magnesium supplements may be helpful, but not enough research has been done to recommend them as effective treatments for period pain. What can I do at home to manage my period pain? Exercise. Exercising most days of the week can make you feel better. Aerobic workouts, such as walking, jogging, biking, or swimming, help produce chemicals that block pain. Apply heat. Taking a warm bath or placing a heating pad or hot water bottle on your abdomen can be soothing. Sleep. Getting enough sleep before and during your period is important. Being well rested can help you cope with discomfort. Relax. Meditating or practicing yoga also can help you cope with pain. What if my pain is caused by endometriosis? If your symptoms or a laparoscopy point to endometriosis as the cause of your period pain, your OB/GYN may recommend you try a birth control method. The pill, the implant, the injection, or the hormonal IUD. Medications called gonadotropin-releasing hormone, GnRH, agonists also may relieve endometriosis pain. GnRH agonists may cause side effects, including bone loss, hot flashes, and vaginal dryness. They usually are used for a short time. What if my pain is caused by fibroids? If fibroids are causing your pain, the first step may be to try NSAIDs, a birth control method, or GnRH agonists. If these do not work, a treatment called uterine artery embolization, UAE, may be recommended. In this procedure, the blood vessels to the uterus are blocked with small particles. This stops the blood flow that allows fibroids to grow. Most women have normal menstrual periods after UAE. In some women, periods do not return. What if my pain is caused by adenomyosis? If adenomyosis is causing your pain, NSAIDs, a birth control method, or other medications may be recommended. UAE also can be done to treat adenomyosis. When is surgery an option? If other treatments do not relieve pain, surgery may be recommended. The type of surgery depends on the cause of your pain. Fibroids can sometimes be removed with surgery. Endometriosis tissue can be removed with surgery. In some cases, the tissue returns after the surgery, but removing it can reduce the pain in the short term. Other medications. Taking hormonal birth control or other medications after surgery for endometriosis may delay or prevent the return of pain. Hysterectomy may be done for adenomyosis if other treatments have not worked. Hysterectomy also may be recommended for other conditions when they cause severe pain. This surgery usually is a last resort. Lifestyle and home remedies. Besides getting enough sleep and rest, things you might want to try include: exercise regularly. Physical activity, including sex, helps ease menstrual cramps for some women. Use heat. Soaking in a hot bath or using a heating pad, hot water bottle or heat patch on your lower abdomen might ease menstrual cramps. Try dietary supplements. A number of studies have indicated that vitamin E, omega-3 fatty acids, vitamin B1, thiamine, Vitamin B6 and magnesium supplements might reduce menstrual cramps. Reduce stress. Psychological stress might increase your risk of menstrual cramps and their severity. Alternative medicine. Acupuncture. Acupuncture involves inserting extremely thin needles through your skin at strategic points on your body. Some studies have found that acupuncture helps relieve menstrual cramps. Transcutaneous electrical nerve stimulation, TENS. A TENS device connects to the skin using adhesive patches with electrodes in them. The electrodes deliver a varying level of electric current to stimulate nerves. TENS might work by raising the threshold for pain signals and stimulating the release of your body's natural painkillers, endorphins. In studies, TENS was more effective than a placebo in relieving menstrual cramp pain. Herbal medicine. Some herbal products, such as pycnogenol, fennel or combination products, might provide some relief from menstrual cramps. Acupressure. Like acupuncture, acupressure also involves stimulating certain points on the body, but with gentle pressure on the skin instead of needles. Research on acupressure and menstrual cramps is limited. It appears that acupressure may be effective than a placebo in easing menstrual cramps. Balanced, healthier nutrition reduces the severity of dysmenorrhea. Vitamins and dietary modifications have been associated with reduced menstrual pain. More regular physical activity is effective in reducing dysmenorrhea complications. Exercise acts as nonspecific analgesia by improving pelvic blood circulation and stimulating the release of beta endorphins. The primary goal of treatment is to reduce the pain and improve the quality of life of patients suffering from dysmenorrhea. Hence, analgesics should be given appropriately to allow women to perform their day-to-day chores. For those patients having dysmenorrhea along with heavy menstrual bleeding, endometrial ablation may be an option. Patients should be asked to follow up with their clinicians when dysmenorrheic symptoms are uncontrollable and bothersome.